Good afternoon, Lopez Lewis. I'm Mihiraa. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It's always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning, Mihiraa. It's Lopez Lewis, the nurse. I hope you're feeling a bit better today. I'm here to check on you after your small fall at home. How are you doing today, and how have you been feeling since then?
Oh, hello, nurse. Thank you for coming. I'm doing all right, I suppose. It was a bit of a shock that fall. I've been a bit stiff and sore, but otherwise, I'm just getting by.
I understand, Mihiraa. Falls can certainly be unsettling. To make sure you're recovering well, I'd like to just check a few things. Could you tell me a little more about what happened during the fall?
Well, I was just walking from the kitchen to the living room, and my foot seemed to catch on something, and down I went. I have a bit of a bruise on my left hip, and it's a bit swollen, but no cuts, thankfully. It hurts a bit when I try to get up from a chair, or when I turn quickly, but it's manageable. Well, I don't think I hit my head, and I certainly didn't lose consciousness. I was aware of everything.
That's good to hear you didn't hit your head or lose consciousness, Mihiraa. Sometimes falls can be a one-off, but other times there might be underlying reasons that contribute to them. For example, some common factors can include changes in vision or even side effects from certain medications you might be taking. Low blood pressure, which can make you feel dizzy, is another possibility. Beyond that, the environment in our homes can play a big role. Things like slippery floors, loose rugs, or even the type of footwear we wear can contribute. I was wondering if any of these sound like they might have played a part for you.
Well, my eyesight isn't what it used to be, I'll admit. I do wear my glasses, but sometimes things look a bit blurry. As for medication, I'm on the same ones I've been taking for years, so I don't think that's it. My blood pressure is usually fine. I was wearing my slippers, but they're quite old and a bit worn down, so maybe they were a bit slippery. And yes, I do have that small rug by the doorway that always seems to curl up at the edges. I suppose that's what I must have tripped on.
Thank you for sharing that, Mihiraa. It helps us understand the situation better. It's really common for older adults to experience falls, and it's important to remember that most minor falls, like yours, aren't serious and often don't result in fractures or major injuries. From what you've told me, and from what I've observed, it doesn't appear you have anything serious. It was absolutely the right decision to let your family know and have us come for a checkup. Now, to help prevent something like this from happening again, we can make a few simple changes around the house. For example, removing loose rugs, especially the one you mentioned, can make a big difference. Ensuring you have good lighting throughout your home, particularly in hallways and stairwells, is also very important. If you find yourself a bit unsteady sometimes, even considering a walking aid like a cane could be beneficial. We could also think about recommending some modifications, like installing grab rails in the bathroom near the toilet and in the shower, which can provide extra stability. And perhaps it's time to look into getting some new non-slip footwear for around the house.
I suppose you're right. That rug has been a nuisance for ages. And yes, my slippers are probably past their best. Grab rails in the bathroom sound like a good idea. I sometimes feel a bit wobbly getting in and out of the shower.
That's excellent, Mihiraa. Making those small changes can significantly improve your safety. Now, even though you seem to be recovering well, it's really important to keep monitoring yourself over the next few days and weeks. Sometimes symptoms can be delayed. For example, if you notice any new confusion, increased pain in your hip or anywhere else, or if you start having more difficulty with your balance or walking than you do now, it's crucial to pay attention. Are there any concerns or questions you have for me at this point?
I hadn't thought about delayed symptoms, so I'll definitely keep an eye out for those. No, I think you've covered everything really clearly. I just want to feel confident moving around my own home again.
I completely understand that, Mihiraa, and that's exactly what we want for you, to feel safe and confident in your own home. As a final point, and this is very important, please don't hesitate to contact your GP immediately if any of those symptoms we just discussed worsen, or if you develop new issues like increased unsteadiness, any new or worsening pain, or even signs of infection around that bruise on your hip. Maintaining your independence and safety at home is our main priority, and fall prevention is a continuous effort. Regular check-ins, whether with your GP or through our services, can help us ensure you stay safe and continue enjoying your life at home. We're here to support you.
Thank you, Nurse Lewis. I really appreciate you coming and explaining everything so thoroughly. I feel much more reassured now, and I'll certainly keep everything you've said in mind.
You're most welcome, Mihiraa. Take care. Please don't hesitate to reach out if you need anything at all.